Welcome, everyone, to this episode of the Fired Up and Plugged In podcast powered by Emergency Reporting. This is the podcast for all 21st century fire and EMS personnel. I'm Tom Lewis, Enterprise Training Manager and the podcast producer. Our topic today will be part one of two with our guest. We will be discussing the health and wellness concerns of female firefighters. Our host is retired Fire Chief Randy Brugman. During his 40-year career in local government, Chief Brugman was the president of the International Association of Fire Chiefs from 2002 to 2003. He also served as the president of the board of directors for the Center for Public Safety Excellence from 2004 to 2017. We at Emergency Reporting are grateful to have him as a member of our customer advisory board. Our guest is Sara Jahnke, PhD, and she's a director and senior scientist with the Center for Fire, Rescue, and EMS Health Research at the National Development and Research Institutes, USA. With over a decade of research experience on firefighter health, Dr. Jahnke has been the principal investigator on 10 national studies as well as dozens of studies as a co-investigator. Her work has focused on a range of health concerns, including the health of female firefighters, behavioral health, risk of injury, cancer, cardiovascular risk factors, substance use, and with funding from the Assistance to Firefighters Grant R&D program, the National Institutes of Health, and other foundations. Jahnke has more than 100 publications in the peer-reviewed medical literature. Awards include the 2019 Endowed Lecturer at the Annual Conference of the American College of Epidemiology, the 2018 President's Award for Excellence in Fire Service Research, as well as the Excellence in Research, Safety, Health, and Survival Award, both from the International Association of Fire Chiefs. Truly impressive credentials. We're privileged to have her here with us today, so thanks for being here. And Chief Brugman, let's get it started.
Thanks, Tom. I appreciate it, and good morning and good day, everyone, and welcome back to another session of Fired Up and Plugged In. And it's indeed a pleasure for me to have Dr. Sara Jahnke on the program today. And I've actually known Sara for probably about 25 years. I actually worked with your father on the IFC board for some time. And, when we first met, you were quite a little bit younger. So, and not a doctor. So there we go. You've done a lot of research, especially on our topic today, and that is the topic of, women's health and wellness in our profession. And so I'd like to explore that with you today, if we could.
Yeah.
Yeah. Okay.
Happy to do that.
All right. Well, you've done a significant amount of research into the health of women firefighters, and I think some of your research has shown that both the female firefighter and their department sometimes are breaking new ground when an issue comes up. And so if you could just kind of dive in a little bit and tell us a little bit about, number one, what led you to this research, and then what type of research have you done that I think would be very important.
Yeah. So what led to this research was really that there was not a ton out there. So we've done a couple. The team I work with has done a couple cohort studies where we, followed people across time, and large studies. Like our first study, it was a metro or the Missouri Valley in 23 departments. So 11 career, 12 volunteer, and we went out 799 firefighters. So like a big study, visited everyone twice. We had such a small sample of women that every time we went to publish it, the editors, because we're looking at things like cardiovascular risk factors, and I don't think it was like purposely trying to exclude them from literature, but they'd say like, you can't make statistical comparisons. And so just focus on men. So what we ended up with, and as we looked into it, what everyone's ended up with is this really amazing data set that primarily is published on men in the fire service. And so women, when we would be places and doing data collection, often women would come up and go, hey, do you know about any research on, like, fill in the blank, on pregnancy, on breastfeeding, on mental health of women in the fire service? And the answer was always like, there's just no, because it's not out in the literature. So we actually did end up publishing that pilot data. It was a really small study, but we pulled just the women out and did one paper. But it took like, I think it was probably 5 different journals that we tried to shop it to, because every journal was like, well, it's a small sample size. And we kept making the point, like, we need something in the literature, because then we can cite that to get more research. And so it was, I mean, really the area of research was kind of born out of frustration and kind of a feeling like women deserve this. If we're going to have diversity in the fire service, like there's, does this affect women? And if you come into a field where like nothing is about you, and none of the research, when there's this huge like boom of research going on in the fire service and nothing's about you, like I see that as a problem. So we got funding. First set of funding after that was from NIH, NHLBI, so the Heart, Lung, and Blood Institute funded a project, and we did a lot of qualitative work. So I traveled around and talked to a lot of women in the fire service, talked to men in the fire service in leadership positions, and said, what do you think? What do you think? What's your perspective of these health issues for women? What should we be concerned about? What should we be looking at? And then did a large survey. Followed that up with another project that was funded by FEMA, by the AFG grants, looking specifically at women and the fire service, and did a cohort study so we could look at them across time. And then as part of that, we worked with Jeff Burgess down in Arizona, who did a breast milk safety study. And now we have funded a project also through AFG to look at epigenetic changes in women, and also to look around. We found some really interesting stuff around mental health with women in the fire service and its relationship to discrimination and harassment. And so built off of that, a study where we're basically designing some resource tools for women in the fire service. So it's been really, I guess it was born out of frustration with not being able to get things out or get things published. And then realizing, like, this, not this last research agenda, but the one before, someone, we brought up the health and wellness section, the facilitators. I was one of the facilitators of that section, and with Pat Morrison, and we said, like, we called out specifically wanting to see more research on women in the fire service. And someone stood up and they're like, hey, so this is a limited pot of money. Like, women are such a small sample of the fire service. Should we even be studying them? Like, is it, if it's only 5% or 11%, depending on which group you're looking at, is it worth studying them? And at first I was like, I can't believe you said that. But then I thought, thank you for saying that, because I'm sure it's something that other people in the room were thinking, and no one wanted to be the one to call it out. But I think we had a great discussion on it. And I'm like, we have, if you look at research in the fire service, it's like the last 10 years has been 70% of the research on firefighter health. Like, it's been, 10, 15 years. It's been, some folks were doing it before, but like the bulk of it has really been since AFG started funding. And we know so much now that we didn't know before. We know, all the cancer rates, we are starting to, kind of coalesce around what those numbers are looking like. We know about cardiovascular health. We know all these other topics, but primarily on men. And I'm like, if you're a woman with breast cancer who's fighting for presumption, and when I'm writing up the report, I say, there's not a ton of epi literature on this, so we can do the mechanistic. I'm like, then we're already too late with that. And we did find that some of the recruitment and retention issues might be related to the lack of information about health and wellness. Can you have a safe pregnancy? Can you, all these types of things that the fire service is lacking. And I think we absolutely need to be studying the health of women in the fire service, especially as the fire service. I mean, your topic is, kind of the next date, like the future of the fire service. Everything's pulling for more diversity. The more we learn about the benefits of diversity, the more we realize we need to be pulling for that, and we need to know, like, you have to know how you're affecting people's health. I mean, I think the same reason that we should be studying the health of men in the fire service. I think it's important to know what you're getting into and how to protect yourself.
No, I totally agree, and I think you hit on a really critical issue, is that the Fire and Emergency Services in the next 30 years is going to be a much more inclusive organization. It just is, whether it wants to be or not. It will be, and so we need to be armed with this information. I mean, and I think some of your research has really elevated some topics that we often, and I don't think a lot of even chiefs today are thinking about, things like breastfeeding and how do you, I mean, there's some impact there, and when do you take a female off the line when we know she's pregnant? What is safe? What isn't safe? what does the exposure actually do to the infant as it's growing in the womb? I mean, there's a lot of different issues, and I think you've focused on some of those. So maybe you could just highlight a few of those, because I found it fascinating, some of the issues that you were talking about.
Yeah. Well, so we have we did some survey stuff early on, and one, made some mistakes in the survey questions we had. So we have some great early data that we're like looking more into and doing follow-up studies. But I mean, the beauty of being in science is that like the summary of every study you ever do is like more research is needed. So it's total job security, it's total conflict of interest, but it's true. And so what we found, our first paper, when we looked at maternal and child health issues, the first one was that we did find a high rate of miscarriage. We also found a high rate. In fact, it was, I think, a little bit over double what we found in like a similar general population number. We also found a high rate of preterm labor. So we have we followed up with another study, and actually one of Dr. Burgess's doctoral students is working on a publication right now, and she's also looking at career and volunteer. Now, preliminary, and I was going to say, don't quote me on this, but this is being videotaped. So feel free to quote me on this, but it's not published. She's finding similar stuff. So looking at, she's finding still high rates of miscarriage compared to the general population. She's actually, in her preliminary analysis, found higher rates for volunteer firefighters than career firefighters, which is kind of an interesting finding that I didn't expect, but I think there's some mechanistic reasons that might be. And then also, so we found the miscarriage, we found preterm labor. We asked a lot of questions around policies. It's fascinating the number of departments that don't have a policy around, because like it seems like that's a pretty basic, that's a pretty basic thing. A lot of departments did not have policies. Now where I dropped the ball in hindsight, like we asked, does your department have pregnancy policy? Does it have maternity leave policy? Where I dropped the ball is I assumed if they had a policy, it was a good one. We've found since then that a lot of departments, and some of them maybe even been on the news, but a lot of departments will have policies that are not advantageous or supportive of women in pregnancy. So like, for instance, some departments will have policies that if you get an injury and it's not an on-the-job injury, that you can't move to light duty, right? So you either have to take sick leave or that you can't. So they don't consider a pregnancy. They consider pregnancy an injury, but they don't consider it a job-related injury, which my answer to that is always just like, get pregnant on duty. And then like we're all, then
well, that creates another beautiful.
But by the letter of the policy, it's a job-related injury. But there are women that then are like required to stay on the truck unless they want to go off, unless they want to use up all their sick time. So my wrong assumption was that policies all were good policies. And then there's also always the complaint that, women can't get special treatment. So if they get pregnant, if men can't get off, and I'm like, for that same injury, then absolutely men should get off for pregnancy just the same way that women do. Like they should be given the same amount of pregnancy leave as women who get pregnant. Absolutely. But I think some of those things are real challenges. We did learn definitely through the qualitative piece that you do not want to be the first woman to get pregnant in a department, because then everyone looks to you to say, what's the policy? And then of course, if they feel like it's too lenient, then they feel like you're just trying to get out of work. And if they feel like it's too strict, everyone's like, oh, you're putting your baby in danger. So like it's a delicate balance, and it is. I mean, looking at the rate, most women don't report their pregnancy to the department until the end of 12 weeks, which totally makes sense, right? Most people don't report pregnancies in general until 12 weeks because of the concern that, if they miscarry but the scary part about that is that really early in the pregnancy is when those teratogens are most affect the fetus. And so having, exposure to those early on is also a challenge. So it's There's
That's
a lot.
difficult.
There's a lot.
Yeah, I know. I ran into that issue as a chief, and first female that I had that became pregnant, and comes in and says, "I'm pregnant. What do I do?" And I go, "Go to your doctor." I have no idea.
Yeah.
Is it safe or it's not safe? And I don't think the pediatrician, the doctor even knew really, because I don't know if they really realize the scope of work that firefighters do, which is an issue. So yeah, it was problematic. I don't think we did the right thing. But we tried, and I think you hit on that point. Is sometimes you don't know what you don't know.
And so that what you just said is exactly what we heard over and over again. Is that chiefs, leaders would say, I said we'll defer to the doctor, and that's the struggle. Is the doctors don't know. Like we've done some work around that, and doctors typically. I was pregnant at the time we were doing this research, and I went and asked my doctor, and I said, so if I were a firefighter, she didn't have any firefighters as OB patients, but I said, when would you take me off the line? And she's like, I would have no idea. I'd go and look at the guidelines and see what's recommended. You know what's recommended in the ACOG guidelines? Nothing, because it's not something that's just been covered yet. Yeah. So then the question is if you go, typically, and this is the conversation that I've had, and most of the women that I know that have had kids have had with their OBs. Can I do X, Y, Z? Can I work out? Can I, until you don't feel like you can anymore. And one of the things I have learned about women in the fire service from talking to, hundreds, if not thousands, is that they are driven individuals. They are, they tend to be, in terms of rates of obesity for women in the fire service, extremely low, lower than the general population, lower, healthy, fit. When you look at measures of fitness, they tend to be pretty active. They are driven to do their jobs, and they are working sometimes twice as hard as the other people because they feel like they always have to prove themselves. And so they don't want to ever be perceived as the weak link. A lot goes into not being perceived as the weak link because it's assumed they're weak just, physically and mentally because they're women. So they are not looking to escape the system in general stuff. But a lot of, people say, well, I told my OB, I'm a firefighter, but we don't do that many fires, or I'm a driver operator, so really I just drive the truck. You're driving the truck, but also putting on gear, also standing in a plume of carcinogens. So that decision, that's some of the work that we're doing now. We're working with Women in Fire and trying to come up with some model policies, some model resources for OBGYNs. And so if you go into your OB and say, hey, I'm pregnant, what should I, then you have something to go here's what that means. It doesn't mean that I am just riding in a fire truck. It means that I'm lifting these things, I'm exposed to these, noises. I already have shift work against me, which sleep is always a concern. And just make it, I just think that women need to be aware. I don't think some of the stuff, it's with, men in fire service, there's some of the stuff we can't engineer out. But I think they need to be aware. And if, women are struggling to get pregnant, I think they need to be aware that could be job related. And, yeah.
So are the guidelines that you're developing, I think, will be not only, for the OBGYN, but also for the department. And so if a female firefighter called you today and said, I just found out I'm pregnant, what should I do?
I hate that question because because I'm always I don't want to tell you what to do. I can tell you what the data says. I don't want to tell anyone what to do. Yeah. And because it's such an intense and personal choice, and so this is the only time that I almost thought I'm going to have to break up a fist fight in a focus group, was when this topic came up about when you go off the line. We had a focus group. I underestimated the sensitivity of this topic. And there was one woman who was I'd had 3 miscarriages the minute I found out I was pregnant. I went to the department. I was I gotta be off the line. To another woman who fought a 3-alarm fire the day before she delivered her baby. And she's like, I had worked so hard for that position.
Yeah.
There was no way that I was going to leave a minute before, and loved her job, just absolutely loved her job, loved her crew. She's like, I didn't want to let people down. I didn't want to, and I respect like both sides of that issue. I would say though, that I think that it's important for them to understand the risk of what they're doing, and to understand, that it is a higher risk of miscarriage in that instance if you're staying on the line, and make that decision, how you will with your physician, and make sure your physician knows you're at higher risk for miscarriage given your risk factors. I mean, a lot of this stuff, it's like other risk factors, that are related to miscarriage. Like you would want your doctor to know that. So I think, have an honest conversation with your doc about like, here's, this is what the data shows. That's double the risk of miscarriage if I'm, doing this job. So, I mean, double the rate is still a low rate, but it is still double. So
it's difficult to answer. It is personal choice, because I know that they all have worked so hard to get on the job, and I think if they step away, they may feel it will be difficult to get back, and
sometimes it really is. And I mean, that's the thing is like I in like an idealistic way, I'm like, well, but in a very real, like I have heard women who have, no kidding, said, I lost my job because I got pregnant. Yeah. They were like, there was no way for me to stay on. And then there are departments that will do, they'll be like, oh, you can do light duty, but then they give them a job that's like pushing paper. And, firefighters, the worst thing you can have them do is sit at a desk pushing paper, especially meaningless paper that's just moving it from one pile to another, which is, so I think, it's important and I know we're going to talk later about like departments, but having meaningful things that those women are doing when they're on light duty, because they do want to contribute, and they are such a driven group that, it shouldn't be your job, okay, for the next 5 months is to move pieces of paper from one side to the other. And I know that's challenging because some departments only have that job, or they don't even have a paper moving from one side to another job. So it's like, I get it.
So there's a physical element. There's also the mental, emotional element that's as critical as well to keep them engaged and viable. I mean, they have to feel like they're contributing.
Yes. Yeah. And like, why not use them to contribute? Like I said, most of these women are like these totally driven, hardcore, like there's a lot that they can do. And it's a challenge on all fronts. No one wants to feel like they're letting people down. No one wants to feel like they're just, checking a box and not engaged. And so, but then also on the other side of that, like I've been pregnant 3 times, and it's hard. It's hard work growing a human. So there's that whole, those they don't grow themselves.
No, they don't.
No. So I guess technically they kind of do, but you know what I mean.
Yeah, there's a toll that is taken by the female just going through that process. I mean, having watched it, it's very, very tough.
It's a lot.
So one of the other things that I heard you talk about, and we've talked about it a couple of times, is after the baby's born, and then the female firefighter goes back to work, and they're still breastfeeding for a period of time. There's a whole issue about that in the house, the firehouse, and we could talk about the policy and the logistics of that. But there's also another element about bringing things home to the baby.
So both sides of that. One, the policy side, like there are, rules and regulations and laws that protect, like that you need to have a place for a woman to pump and to, like, that's not sitting in the bathroom, that you have an area that they can store their breast milk that's separate, those types of things. And then there's the carcinogen side, and that is So Dr. Burgess did a pilot trial because he kept getting this question from folks in Phoenix, from women in Phoenix. And so he did a pilot trial, and he tested breast milk up to 72 hours post-incident. And when he did it in the pilot, it was a small study, and he found up to 72 hours, he still saw a spike. So that's why we said, let's do a larger study and see, and then compare it. Because, you can have contaminants in your breast milk from all sorts of things, from being out and, being exposed to it, like just at home or, whatever. So designed another study. He did a great study, and this one hasn't been published yet, but so he's still working on it. So again, preliminary data that's not, it's got to go through the peer review process and all that kind of stuff. But larger study, women around the country, and then also got breast milk from their friends. So like as a control group, so someone who was in the community, the same community. And he did preliminary analysis of that, does still show at 72 hours that was not just like an artifact of that one woman who'd been exposed to something. So it does look like things persist up to 72 hours in the breast milk. So, his initial recommendation was pump and dump for 72 hours. If you're still seeing stuff at 72 hours, then we don't really know how much farther it goes because we didn't anticipate it to go to 72 hours. It's just something that definitely needs to be thought about. But I think that also speaks to the importance of, most firefighters aren't running a ton of fires, and so at that time, to keep storage of breast milk up, I think it makes it even more important to allow for that on duty, because that, if you want to provide your baby breast milk up until the recommended time, which now I think they recommend up to a year, but definitely like that 6 month mark, you've got to keep that up. You've got to keep the pumping up basically when you're not around the baby, because otherwise your milk supply dries up. Yeah. That's another thing I thought was interesting, is that I didn't realize how much, like I was presenting somewhere one time and I said something about, you've got to pump and dump for 72 hours, and all the men in the room were like, and I'm like, oh, I guess not everyone knows the ins and outs of how breastfeeding works.
Yeah.
So there's some opportunities for education there too. So yeah. Absolutely. So but I think women need to know that as they're making decisions about how long they're gonna, I would highly recommend pumping and dumping for 72 hours, but depending on exposures and, calls and stuff like that, I mean, longer than that might be necessary, and we don't empirically know how long that should be if they choose to breastfeed while still actively firefighting.
Yeah.
So yeah.
Well, that could probably translate to the male firefighter as well, then, right?
So this is really interesting too. I get so nerded out excited about this stuff, but I just think that's the cool thing about all this research. Like, so we know, we found the miscarriage rates were high. We found the preterm labor rates were high. We found that it was, there were contaminants in the breast milk. So there's some discussion too about, well, what about men in the fire service? Like, we know that the mechanisms of what affects your body is not all that different. I mean, you have different body parts that affects, but so, again, Jeff Burgess has compiled a team, NIOSH, someone from BYU, and we put a proposal in where it wasn't accepted the first time, so I think we're going to rework it. We've got to get this funded somewhere, because there's some folks who believe that, well, first on the fertility side of things, there was a study out of Europe that found male firefighters were around 46 to 50% more likely to seek fertility treatments than non-firefighters. So, I mean, it could be, but it was a country with universal health care. So it's not like they just didn't have access to the care. But, more of an issue with fertility for males is what that suggests. And then there's been some conversation too around, does it affect the offspring? So there was an EFO report out of, I believe, Washington State, that where they reported, the chief that did it reported a cancer cluster of offspring of firefighters in that department. So interesting, really interesting preliminary data. So we pulled together a group, Jeff pulled together a fantastic group, and asked about, what could we study on this? And so we designed a study, two pieces of it. One is looking at sperm epigenetics. So looking at, which that's a job. Like there's a epigeneticist at BYU whose whole job it is to study sperm. And I asked him about that. I said, how does that go at like dinner parties? He goes, people get real quiet. So you say, what do you do? I study sperm. But yeah. So his hypothesis, and they have some preliminary data that says like, yeah, this could be a thing. The idea being getting recruits before they go into, before they're fire exposed, and then going back in recruit school after they've started fighting fire and looking at the difference. And it does look like you see differences in sperm after they've been fire exposed. So like, what are the implications of that? Probably why you see some of the fertility issues, but also for offspring. When we designed, started talking to Jeff, had these awesome folks that were interested in child health outcomes. And he basically said that they expected to see, based on like the whole picture of what firefighters face, they expected to see higher rates of attention deficit disorder and autism spectrum disorders among the offspring of firefighters, male firefighters. Super interesting. Now we don't know yet. We don't have the data on that. We didn't know if we could collect a large enough sample because childhood cancers are so rare to look at those types of outcomes. But it is interesting. So both through like sperm epigenetics, but also if you think about, if you've seen any of those videos where they talk about like contaminants and how much they get on you, and if you're not like fully decontaminating, showering and all that kind of stuff, you can take that home. Like, could that play a role in it? I don't know. Again, more research is needed.
Yeah, exactly. But I think, it's something that we really have to, I think, get our hands around. I know we all like to go in and fight fire and get dirty and do that. I mean, it's a challenging, exciting job. But I mean, the exposure that we're putting our people through, I just don't know. We've got to find another way to, I guess we have to find another way to fight fire more safely.
Yeah. I mean, and that's where I think, I kind of in some ways think of it. My other research, I've done some research in like tobacco industry stuff and looking at the impact of tobacco. And it's kind of like that, where like there was a point in time where you didn't know, right? Like you thought, smoking might be bad for you, and then once there was like this whole set of data that you were like, wow, that's pretty, I feel like we're kind of getting to that tipping point with firefighting that like, and I see shifts that I love, like that you see less ads with like filthy firefighters now, I mean, they're trying to like put firefighters in cleaner gear and like movement towards clean gear and, wash your hood Sunday, or I think there's a cooler name for that. But I feel like we're getting that data right now to go, whoa, this doesn't just, higher risk of cancer, but that's way at the end of my career. But maybe affecting my child that I'm conceiving next week, that's a whole different,
that's a whole different discussion, isn't it? Yeah, it is. And, we're bumping up on our time on our first segment, but I would like to have you back where we can kind of continue to explore this topic. And also I'd like to get into a little bit about from an organizational perspective, what should senior leadership be looking at today and in the future, and what can they do to begin to craft policies to make it safer, not only for the female firefighter, but for the firefighters in general. So Dr. Jahnke, all right, thank you for being with us today, and we'll be back in a second podcast segment and very, very shortly. Thank you.
Awesome. Thanks.